Hello, my name is Arnold. I'm going to be performing a neurological exam. So the neurological exam consists of several components, which includes the cranial nerves, cerebellum exam, reflex, and cognition. So we're going to start off with cranial nerves. We're going to start off with cranial nerve number one, the olfactory. Usually this is deferred a lot, but we're going to do it today. So what we're going to do is I've got a fragrance, and you're going to close your eyes and occlude one of your nostrils and let me know what do you smell. Okay, what did you smell?
Like cinnamon.
Now close your eyes once again, occlude your other nostril and let me know. Okay, what did you smell?
Cinnamon.
Okay, so yes, we indeed used the same one. So that was cranial nerve number one. Cranial nerve number two is the optic nerve. So for the optic nerve, we're going to start off with a Snellen chart. This is a hand chart which is equivalent to, we're just going to hold it 14 inches. We're going to ask the patient if they use glasses. Do you use any glasses?
No.
Okay, so now I'm going to hold this in front of you. You let me know in which line you could read and just tell me the numbers, please.
525983.
5259. Okay, close your right eye.
525983.
Okay, so it's 2020. Now close your left eye.
525983.
Okay, about the same. So now we're going to continue with the optic nerve. We're going to do the peripheral vision, and we're going to test this by the wiggle test. So what I'm going to do is I'm going to go in front of you. I'm going to wiggle my fingers. You let me know when you see the fingers, okay? Look at me in the nose, please.
No. No. No.
Okay, so he has a good intact peripheral vision. Now, also part of the optic nerve is the fundoscopic exam. We did a more detailed exam on the previous, but we're gonna do the fundoscopic exam. Okay, so I'm gonna go with a 90-degree angle. If you just continue looking and focusing forward, I'm gonna look at for the red reflex, right on right. Okay, red reflex is achieved. We're gonna go in. Okay, we see the optic disc, no papillary edema noted. Everything looks otherwise normal. We're going to do the same for the other side, left on left. I'm going to use my left eye for his left eye. We're going to achieve the 15-degree angle. Keep on looking forward, please. We got the red reflex. We're going to go in. Okay. Well, the optic disc was looked at and everything. It looked normal, no edema, no complications or anything in there. So now we're gonna move on to the ocular motor, and with these tests, extraocular motor test, it actually tests three nerves. And it tests cranial nerve number 3, the ocular motor, the trochlear, which is number 4, and number 6, the abducens. And we could do all these three tests by this next test. Please look at the tip of the pin and just follow the tip of the pin, please. Okay. So he was able to follow with no nystagmus or any lateralization of the eye, good convergence, and we basically tested those three nerves, but we're still going to test the accommodation. We're going to do this by doing an ear test. So what you're going to do is you're going to look at the tip. Now look at the wall. Now look at the tip. Okay, so what we see is that when he looks near, the pupils constrict. When he looks far, they dilate. Now we're going to do with light. Just look at my nose. Look at my nose. Okay, we're now going to do it again. Okay, so what we did is a direct light simulation, and with the people's when you put shine a light, they constrict, and now then we do consensual lighting, meaning that we put light on the other eye. The other one that doesn't have light also constrict at the same time. So he has an intact nerves. Now we're gonna go to cranial nerve number 5, the trigeminal, and the way we test this is it has 2 parts: the motor, and I'm gonna, if you could clench your jaw, and we feel the muscles here, the mastoid muscles, and then we're gonna use sensory, and we do this by testing a sharp and dull. So we have this Q-tip, the dull part, and the sharp part. So please close your eyes. I'm gonna touch various parts of your face. And you let me know if it's sharp or dull.
Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay, so it appears he has a good sensation on the areas of the face. Now we're gonna go to the facial nerve. So facial nerve consists of movement. So I'm gonna have him puff his your cheeks, puff them out, and just smile, frown. Okay, so you see the wrinkling in the face movements. So he has a intact cranial nerve number 7, facial. We're gonna move on to the cranial nerve number 8, acoustic, and that consists of several hearing tests. One of them would be the whisper test. So what I'm gonna do, I'm gonna cover one of your ears. I'm going to whisper something. You let me know what I said, okay?
Apple.
Good. Now we're going to go to the other side.
Apple.
Okay, good. So we just tested with the whisper test, but now we're going to continue with the Rhines and Weber test. So with the Rice test, we're going to do first is going to check for lateralization with bone conduction. So what I'm going to do, I'm going to, you let me know if which ear you hear this sound, okay?
Both.
Good. So that's a normal test. And now the next one is the Rhines test. And this test is bone conduction versus air conduction. Air conduction should be longer than bone conduction, but we're going to test it out. So we're going to go with this side first. You let me know when you stop hearing it, okay?
No.
Okay, you let me know if you hear it when it stops. You hear
No.
it? Okay. Good. So now we're going to go to the other side, test that.
No. No.
Okay, so air conduction was longer than bone conduction, so that's a normal response. Now the next one is the glossopharyngeal, and that one we could do it with cranial number 10, the vagus. So if you could open your mouth, you're gonna say ah. Okay, take your stick your tongue out. Okay, very good. If I had a gloves, I would test strength on that tongue, and this is to assure an intact cranial nerve number 9, the glossopharyngeal, and the vagus. When he says ah, you see the soft palate lift up. So the next one is cranial nerve number 11. That one's a spinal accessory. We could test that by a strength, a sternocleidomastoid. Can you please look at that way? Good. Now we're gonna shrug your shoulders. Okay, good. So he has good intact strength. And now the last of the cranial nerves, cranial nerve number 10, the hypoglossal, is actually the tongue strength, which I did for a 9. So I did it earlier. So same thing, just take out your tongue and we would test the strength, and that's hypoglossal. The cranial nerve number 9 and 10 would be when they say ah and the soft palate moves, and also with swelling. If the patient's able to swallow, he has an intact cranial nerve number 9 and 10. So now we're going to move to cognition, and that one we assess as soon as they come in. We that we keep evaluating their mentation, if they're alert and oriented, if they have a good memory recall. We could probably before the interview ends, we could ask him what what we were talking about, and assess his short-term memory or long-term memory just by talking, and we have a good idea of his mentation or level of consciousness. Right now he appears alert oriented with no memory and good reasoning. So for the next cerebellum test, I'm going to ask you to please stand up. And this one is assessed as soon as they walk in the door, and it's basically the gate. So just for the purpose of this video, if you could please walk over there. Okay, and then now when you come back this way, just walk on your heels. And this is just for cerebellar. Okay, so you can't really appreciate the walk, but he's walking on his heels. Now if you could walk on your tippy toes this way. Okay, very good. He's walking on his tippy toes. Now we're going to do a tangent walk. So basically when that one is going to be heel to toe on a straight line. Very good. So good heel to toe on the tandem walk. Now we're going to do the lumbar test. If you could please close your eyes, extend your arms, and we're going to look for any deviation shifts or any movements, and usually for 30 seconds, but everything is looking good. So good lumbar test. If you could take a seat now. Now we're going to test the coordination. So if you could take your hands and just alternate them with your eyes closed on your laps, like so. Okay, good. Now for the next test, it's a positioning sense. We're going to ask the patient to close his eyes. We could either use a toe or his finger, and we're going to, you close your eyes. You let me know if, where am I turning this finger?
Up.
Okay. Now we could do the same with the toe. Let me know when you turn your toe.
Down.
Okay, good. So he has good positioning sense. Now for the last one on the cerebellum, I'm going to give him an object. It should be a familiar object to the patient. Ask him to close their eye and just hand it to them, and they're going to tell you what the object is. Can you please close your eyes before I give you this object? Okay. You tell me what this is, sir?
A pen.
Okay, well, very good. It is a pen, so he has an intact, and this is part of the cerebellum sterognosis. I'm sorry for that pronunciation. So now we're gonna go with motor. This is gonna test his strength on the major muscles. So what we could do is first off with the upper extremities with the biceps. So what I'm gonna do is I'm gonna have you go like this, flexing your muscles. Good. And I'll extend them. Push me down, please. Very good. And that's for the bicep and tricep. And now for the shoulders. Don't let me pull your arm, okay? Okay, good. Same side. We could do it both at the same time. Basically, testing that they're showing the same. It's just very hard in this positional angle to get a good picture with the video, but we're also at the same time inspecting and looking for any hypertrophy or cachexia or anything, muscle wasting or any abnormalities or asymmetry between both. So if you can extend your arms like that, abduction. Now don't let me pull down. Like I said, we would possibly do the same, and as we did earlier, then go straight like this. Don't let me pull down. Okay, pull up, go like this. Okay, good. So he has a good strength on his deltoids as well, on his shoulders, and now we're gonna move on to the lower extremity strength, or the lower extremity strength. But before we do that, we're gonna do a finger strength. So can I see your fingers like this, please? Okay, don't let me put them together. Okay, good, good. Now close them. Open them, please. Good, good. Very good. Now we're going to move to the lower extremity. So I'm going to put you a little more down so we could do the lower extremity. Okay, so lift your feet up. Very good. Don't push down. Very good. Now, bend your feet, please. Both of them. Don't let me put them together. Okay, good. Close them. Don't let me open them. Okay, abduction, abduction. And those, I'm going to put you, or sit you back. I'm probably going to do, okay, that's okay. Don't let me pull your feet up. Good. Don't let me put your feet up. Good. Push them out. I'm going to try to, don't let me pull them back in. So I'm working on the quads, on the hamstrings, and testing the strength of those major lower extremity muscles. At the same time, I'm comparing them side by side, making sure symmetry. We abducted on both upper and lower extremities. Now we're going to move on to sensation. We're going to continue using the sharp and dull portions of the cotton tip, the dull, and the sharp edges it right now, and we're going to do it in the upper extremities and lower extremities. So we're going to do that. Just on the only thing I forgot to mention on the lower extremity is the plantar. It's hard to get a good appreciation on it, so I was going to defer it, but we could do it right away. So push, like if you were driving a car, like pushing the pedal. Very good. Now up, point your feet up to the sky. Good. So he has good strength bilaterally. Now we're going to continue. We're going to close your eyes. You let me know if it's sharp or dual, okay?
Dual. Sharp. Sharp. Dual.
Okay, you weren't able to see it, but we also tested his lower extremities. Obviously, it's going to be directly on the skin without the clothes on, but the edge stand or the camera won't allow it. Now we're going to go with vibration. So the vibration, we're going to use the tuning fork. And with this tuning fork, we're going to use a bony prominence, whether it be on the ankle or on the wrist. And we're going to have the patient close his eyes and let us know where exactly he feels, if he feels a vibration. So we're going to try it. Let me know if you feel vibration and where you feel it, okay?
Left wrist.
Good. One more time. And obviously, as I mentioned, it's pretty hard to get a good appreciation on the bottom, but we're going to do it straight. We're doing it straight on the skin. He's going to let us know where he feels the vibration, okay? Close your eyes, please. Where do you feel your vibration?
Left ankle.
Okay, very good. So you felt the vibration in the correct position. And now we're going to move to the reflexes. We're going to use a tuning hammer, and we're going to test the bicep. I'm going to hopefully get a good angle here. Okay, just relax your arm. It's hard to get a good angle here, but we're going to try our best. You could hit it direct on the tendon or I'm going to try this. Okay, we see some reflex, pretty hard to get the appreciation. We do the same on the other side. Let's see if I can get a better angle on this one. Yeah, we probably can. So we're going to test the bicep. There you go. Very good. Now we're going to test the tricep, and we're also just going to have the patient relax. And it's hard to get a good angle on these, but let's give it a try. Okay, very good. Let's see if we can get a good angle on the other one. And we rate the reflexes on if they're very hyperactive or they don't have anything or they're just normal. And we're going to try this one again. Just relax. There you go. So very good. So that was the bicep tricep. Now we're going to go to the patella. That's probably the one that's most known for many practitioners. It's the one here. The feet should be dangling. Unfortunately, this is the placement we have right now. But I'm going to move the camera a little bit so you get a little better appreciation of the situation. Okay, so it would be better to have this up, and then what we're gonna do is have this dangled, and then with the patellar, and then hit it. Okay, it moves there. Very good. Now we're gonna test this one. Have it dangled. Okay, so that was a patellar reflex, and now we're gonna do the Achilles, and we're gonna try our best as well. Did get a good angle for the camera. Put this up and just relax. Okay, very good. We got a good reflex now with this one. Okay, very good reflex on both. Now for the final portion, superficial reflex, we're going to do the Babinski. On this one, it'd probably be easier if we put them a little flat just for this one. And it would be without the shoe and sock. So we're going to remove one side only. We're actually going to do it both, but just for the purpose of this video, we're just going to finish it off on this one. So we're going to go straight and then curved. And what we're expecting on a normal is plantar flexion, meaning these toes are going to face down. So we're going to do this, 1, 2, 3. Okay, very good. So this concludes our neurological assessment. Thank you.